This week I.
The same one, it's just the extra copies of it.
Thank you.
So if you go to Brightspace,
By and they're just, probably with. They are, you get it then. Ready.
okay, so we're gonna do chapter 15. Should only take us about an hour or so, maybe an hour and 15 minutes, and then you guys will be all set. And then that's the last of the new material. Chapter 15.
Okay, it's fantastic.
Yep, everything's in the same packet. It should be right towards the end. So,
That's all, it should have, I got all the. Okay.
so part is about the size of the fist. Okay. It's gonna lie in a cavity called the mediastinum. And if you remember, we talked about the mediastinum all the way back in chapter 1, right? The mediastinum is inside. It looks like my last packet got grabbed, but I can make copies for you. Let me go through this one quick. It should be in this packet. Yeah. Let me just go throw this on the center really quickly.
Probably the 9 minutes they get back. So we didn't do that. Yeah, but I didn't get all. Yeah, I didn't get all of it. That's the next. We got to recover kind of individual work, kind of science, or kind of the answer. That's what I mean. Things that come jumping. This is just.
Okay, so part is about the size of the fist. It's gonna lie in a cavity called the mediastinum. Okay, and there are 2 parts to the heart that we want you guys to be familiar with. Okay, you have your base, which is talking about the widest part of your heart, and then you have your pointed tip, which is called the apex. Now, with the base of the heart is actually found at the top. Okay, and this is going to be where all of your great vessels come in and out of. Your apex is going to be where you can feel what's called your maximum point of impulse. So if you're curious, you can take your hand, make your hand flat, put it on your 5th intercostal space, and you can actually feel that like something there. That is going to be at the apex of your heart. I'm gonna start with this slide first, and then I'm gonna go back. There's actually. Where's my computer? Okay. So your heart wall is gonna have 3 different layers to it. Okay. First layer you have, the innermost layer is called your endocardium. What does endo mean? In. Endocardium, your innermost. What about epi? What does epi mean? Outer. So your outermost layer is your epi. What does myo mean? What is it? Muscle. Just so happens that the myocardium is also in the middle. That helps you remember. Myo means muscle, myo means middle. Okay, so your muscular layer is going to be the thickest layer. It's made up of cardiac muscle. Now, you also have this fibrous sac that surrounds your heart. That is called your pericardium. Okay, so your pericardium is going to be that sac that surrounds the heart. You guys do not need to know the different layers of it. If it's not in this package, don't worry about it. What page is this for? Okay. This is the picture from your book. If you want it all on one slide together, it's there. Now, you have these things called great vessels that are going to be the main, like, arteries and veins of your body. Okay? So they're good to know when we talk about the flow of blood through the heart. This heart diagram is obviously not anatomically correct. Okay? The whole point of this, I really like how this lays it out for, like, schematic purposes. Don't go get this tattooed on your body. People are going to look at you funny. So, we're going to start with the, like, major veins. Okay? What does superior mean? Above, inferior, below. Superior vena cava is going to be draining from the upper body. Inferior vena cava is going to come from the lower body. You can abbreviate these SVC and IVC. Okay, that would have been right in superior and inferior vena cava. Okay, now these are going to drain into the right side of your heart. Now, the other thing to know about this diagram, and pretty much any diagram when it comes to, like, blood circulation, blue is going to indicate deoxygenated blood. Okay, what I mean by that, that is blood that the oxygen has been used up from. So our body has used up the oxygen from this blood and sent it back to the heart for circulation back to the lungs, which means red or pink is oxygenated. Okay. Now, once it comes into the right side of your heart, we need to get it oxygenated. So it is going to go back out to the lungs. What does pulmonary mean? Lungs. Okay. Do arteries go towards or away from the heart? Away. So pulmonary arteries are going away from the heart in general. So artery away from the heart. So your pulmonary artery then, just using an educated guess, is going where? If pulmonary means lungs, arteries away from the heart, pulmonary arteries going towards the lungs. Okay? So the pulmonary artery is going to carry deoxygenated blood back to the lungs. And we're going to go through the diagram, like the labeling diagram together. Okay? So it's going to go to the lungs. The lungs are then going to take away the oxygen, and it's going to put oxygen into the blood.
Or you said the pulmonary arteries taking
Deoxygenated blood away from the heart towards the lungs. Now it is going to come back. If arteries are going away from the heart, what's coming towards the heart? Veins, okay? So if you have a pulmonary artery, you also have a pulmonary vein. Okay, the pulmonary vein is going to bring that that reoxygenated blood, so the blood that has oxygen in it, back to the heart. Now it is going to come into the left side of the heart. Okay, because if you look, right, you have two sides to your heart. They are pumping at the same time, but you do not want the bloodstreams to mix because one has deoxygenated, one has oxygenated. So once that blood has been reoxygenated, it is going to come into the left side of the heart, okay, through the pulmonary vein. Then it is going to pump back out to the body. You have your main artery called your aorta. That is going to be the artery that then splits into all the other arteries in your body. So when you have something like an aortic aneurysm or an aortic dissection, it is really bad because that is the artery that is going to supply blood to the rest of your body. For the most part, arteries also carry oxygenated blood. Pulmonary artery is the one exception to this. Now, this is what an anatomically correct heart looks like, okay? This is a lot more information than you guys really need to know. The only thing you really want you guys to write down from the slide is this sentence, okay? I'm going to simplify it for you. If you draw a square, just like that, basically your heart is going to be divided into two sides. So you have your right side and your left side, and then you have upper chambers and lower chambers. Your upper chambers are called atria. So atrium is singular, atria is plural. Lower chambers are going to be called ventricles. Okay? So, looking at our beautiful anatomically correct square of a heart, you have a right atrium. You have a left atrium. You have a right ventricle, and you have a left ventricle. Okay? The whole point of the rest of this slide, basically, you have two separate bloodstreams. You have a deoxygenated going through the right and an oxygenated coming through the left. Okay? That's our heart. Very simple. Now, in order to ensure that blood is flowing in one direction, okay? Oh, we start with this MCQ. The sac surrounding the heart is called what?
The pericardium.
Pericardium. What is the innermost layer called? Endocardium, outermost layer. Epicardium, muscular layer. Myocardium. Okay. Now, to make sure that your body or your heart has one-way flow of blood, okay, we have these things called valves. Now, we have two sets. So the first set is going to be your atrioventricular. Atria, what do you think atria is referring to? Atrium, what about ventricular? Ventricles. Atrioventricular valves sit between your atria and your ventricles. You have one for your left side and one for your right side. Okay? The way that I remember which one is which. Does anybody know what the prefix tri means? Three. And the letter R, if you use your imagination, there's 3 lines. Okay? So the right side of your heart has your tricuspid valve. What about bi? What does bi mean? 2. So the letter L, again, using your imagination, has 2 lines. The left side is your bicuspid valve. Okay. Now your bicuspid valve is also called your mitral valve. You guys will be responsible for knowing both of those terms, okay, bicuspid / mitral valve, it means the same thing. Okay? Now, you also have valves sitting between the ventricles and the great vessels that go back out to your body or your lungs. These ones are really, really, really easy, okay? We said that the artery that brings blood to your lungs is called the what? Pulmonary artery. The valve that sits next to your pulmonary artery is your pulmonary valve. What about the artery that goes to the rest of the body? Aorta. Aortic valve. Do not overthink it, okay? Pulmonary valve goes to your pulmonary artery. Aortic valve goes to your aorta. So the whole point of these valves is to make sure that you have one-way flow of blood. So if we're going through and doing the laydown together, because I know this diagram has a lot on. So we're going to start with the blood coming from the body, okay? You have two big veins bringing blood from the body. You have your superior and inferior, what are they called? Vena cava. So you can just abbreviate it SVC and IVC. Okay? Is this the right side or the left side of the heart? Right. Upper things are called what? Atria. So this is going to be your right atrium. Okay. Sitting between your right atrium and the lower chamber, which I'm not going to tell you the answer of, is going to be an AV valve. What AV valve is it? You have 3 lines. Tricuspid. Okay. The tricuspid valve. Lower chamber of the right side is called what? Right ventricle. Now your right ventricle is going to flow out to your lungs. Okay, so what's the name of the vessel that brings it to your lungs? Pulmonary artery. What valve sits before the pulmonary artery? Pulmonary valve. Pulmonary valve. Okay, pulmonary valve. We're going to go to our lungs. Our lungs are going to add oxygen into our blood. Okay, if our pulmonary artery is taking it to the lungs, what is coming away from the lungs towards the heart? Pulmonary what? Vein. Pulmonary vein. Okay. Now we are looking at the left side of the heart. What are the upper chambers called? Left atrium. Okay. Your left atrium is going to flow through this valve. Bicuspid. What's the other word for bicuspid? Mitral. It is going to flow into the lower chamber. Okay, this is called your left ventricle. Your left ventricle is going to flow into this big artery that supplies the rest of your body. Aorta. Aorta. And then what's the valve that sits between the left ventricle and aorta? Aortic valve. Beautiful. So this is kind of what your diagram should look like. Leave that up here for a second. Okay. So your heart does have this thing called your heart skeleton. Your heart does not actually have bones inside of it. This is just like cartilage that supports your heart. Not in your packet, don't stress about it. Okay. It's just so that if you hear the term heart skeleton, that's what it is. Now, as far as valves opening and closing go, your valves are not like pulled open by muscles. They are just forced open when the blood flows through them. Okay, you don't actually have muscles that pull your valves open and closed. That's all this says. Okay. Now you do have these things called chordae tendineae. So if you've ever heard of like pulling on your heartstrings, these are your heartstrings. The whole point of these are just to keep that valve from like flipping inside out like an umbrella would. Okay. So if you've ever heard of like aortic regurgitation or like something like that, what that means is that your valves are not working properly and that they're like opening up so that blood is like backflowing. The chordae tendineae is one of the things that are going to help prevent that from happening. This is just a cool animation showing you how they work. But again, we're not focusing on them. So if you want to watch it, it's there for you to play. Which valve controls the flow between the left atrium and left ventricle? Mitral. Okay. Pulmonary valve. What does the pulmonary valve sit between? Oh, well, just kidding. It's up there. Pulmonary valve goes to the pulmonary artery. Okay. Aortic valve goes to the aorta. Tricuspid valve. Remember, there's those 3 lines. So it's the right. Mitral valve is also called your bicuspid valve. It's going to sit between your left side. Now, whole point of this, again, you do not want the blood flows to mix. Okay, you want to keep the deoxygenated blood and the oxygenated blood separate. That's why when you see babies with like ventricular septal defects or like atrial septal defects, okay, that's why they need to get fixed because otherwise you are like sending out less oxygen into your body than needs to be done. So those are kind of common in kids, especially with like kids with Down syndrome for some reason have a really high incidence of it. This is showing the same thing that I just went through on that one diagram. These are just the diagrams from your book. So if you prefer these, they're there. It just shows you, again, vena cava coming to your right atrium. Right atrium goes into your right ventricle. Right atrium goes into your right ventricle. Right ventricle goes out to your pulmonary arteries, where it's going to go to your lungs. Once it gets oxygenated by your lungs, comes in through your pulmonary veins. Pulmonary veins drain into your left atrium. Left atrium goes down to your left ventricle. And then your left ventricle is going to go out to your aorta. Okay. So if you prefer like a step-by-step pictures, these are here. And this is also typed up for you guys. Now, I do like this video because it shows you the flow through the heart, and the guy does like a really nice like 1-page summary. So I usually show this one just because it's like 5 minutes long. So, like I said, it's a little more chaotic, but it is like a nice, like, I don't know, 1-page summary. So, if you just Google, you'll see like a lot of mnemonics for remembering the order of the valves. Like when I heard try to pull in my aorta, is there. So. Now, the heart obviously is still doing work, right? So it also needs oxygen. However, it is not getting oxygen from the blood that is coming into the heart. Instead, you need on its own vascular system. Okay. This is called coronary circulation. So, coronary circulation, just like arteries are going to supply the rest of the body with oxygen, coronary arteries deliver oxygenated blood to the myocardium. Okay? The difference between coronary arteries and the rest of the arteries in the body. Coronary arteries are actually going to receive oxygenated blood when the ventricles relax, because otherwise they get stuck in between the ventricles, and when they contract, they get squeezed. So when the ventricles are relaxed, coronary arteries are able to fill up. Okay? And then you have cardiac veins that are going to collect that deoxygenated blood and drain it back. Now, because your left ventricle is doing most of the work of the heart, because it's bringing the blood to the body, that is going to receive the highest blood supply. The reason we talk about coronary arteries in this class, because coronary artery disease is the leading cause of death in the US. Okay? So you will see a lot of this. This is a lot of the time is what's going to lead to myocardial infarction. Does anybody know what a myocardial infarction is? Heart attack. So coronary circulation, really important when you talk about heart health. Okay? So this is why they tell you to watch your cholesterol and everything, because these arteries can become narrowed or blocked up. Something called atherosclerosis. Okay, so these deposits get hard and stick into the coronary arteries and block those. If you interrupt the blood supply, it can cause what's called ischemia, which is just deprivation of oxygen. And over time, cell death, aka necrosis, can occur. So necro means death, necrosis is the process of cells dying. Now, sometimes this interruption is temporary, sometimes it can cause myocardial infarction, right? Luckily, your body has a way of preventing this. You can develop what's called collateral circulation, which is just basically your body makes these like side roads so that it can like bypass these fatty deposits. But it's only going to make those if like this is happening over time. Okay? So if you start to get this narrowing artery over time, your body will start to make these collateral vessels before it completely blocks off. If it's like immediately like a blood clot gets in there, then you don't have time to develop those collateral vessels, right? You can also get these collateral vessels by working out. So this is one of the reasons why exercise is really important for heart health, because it can help you to develop these collateral vessels to counteract the effects of atherosclerosis. So, which great vessel supplies blood to the right atrium? Superior and inferior vena cava. Now for your cardiac conduction, okay? This is everything right now. I simplified it. Okay, if I can find the mouse again. Okay. For cardiac conduction, the heart's primary pacemaker is something called your sinoatrial node. Sino, you're talking about the coronary sinus. Atrial, you're talking about your atrium, because it is found in your atrium by your coronary sinus. Okay, that is your heart's primary pacemaker. Now, it is really important for your heart to beat rhythmically and at the correct rate. So your heart has a couple fail-safes. If the SA node fails, your AV node will kick in. Okay? AV node. A stands for atria, V stands for ventricle, because it's found right on the border of your atria and your ventricle. If that also fails, you have a plan C for Purkinje fibers. Okay? So, primary pacemaker, SA node. Secondary pacemaker, AV node. Tertiary, so meaning third line of defense, is going to be Purkinje cells.
So, if you know if the pacemaker cells are instructions will fire.
The AV node or the Purkinje fibers? So the essay note you can think of, I try to remember the word metronome. You know the thing that goes like click, click, click whenever you're like playing instruments? That's like your essay note, okay? This is what sets that pulse at 60 to 80 BPM. If your SA node fails, your AV node will fire. It just fires a little slower from 40 to 60 beats. Purkinje fibers are just like holding on for dear life until you can get some other interventions in there. Just spell that. Purkinje, Purkinje. Purkinje. Now we do have a way to measure this like electrical conduction within the heart. Okay. So if you've ever heard of an ECG or an EKG, this is what it is measuring. It is measuring the path of that electrical impulse. I do not expect you guys to be able to read an ECG. Okay. This is just for your information. If you guys want it. The only thing I want you guys to know, this is a QRS complex. Okay. So this is the QRS complex found on an EKG. Represents the spread of electrical impulses throughout the ventricles. Even that, I just want you to see, hey, this is a QRS complex. Because the QRS complex is important for a couple different reasons, right? So this is going to tell you your ventricles are contracting. If you see something like this, that's not good. If you see like this, not good. Definitely not good. Okay? So your QRS complex, we can also use it to measure pulse. So if I had another QRS complex here, okay, the distance between the two could be the pulse. So that is why the QRS complex is like the most significant part of this ECG. The other parts are kind of important as well, but this one's the easiest to see and recognize and probably the most important. So just know it's a QRS complex and you're good. Arrhythmias are abnormal rhythms in your heart. If you guys want to read more about them, so if you've ever heard of VFib, AFib, this is where those come from. Now, when you take blood pressure, you have two measurements. What are they? Systolic and diastolic. This is where it comes from. Okay. So you have your cardiac cycle, which is just a cycle of one heartbeat. Okay. It's going to consist of systole, which is just when your heart is contracting, and diastole, which is when your heart is relaxing. Okay. So putting this into context. When you take blood pressure, so when you take blood pressure, which number is higher, systole or diastole? Systole, because what systole is doing, it's measuring when the heart is pumping blood into the body. Okay, so that is measuring when those ventricles are contracting. They're pushing that blood out, right? So this is going to be that top number in the blood pressure reading. It is showing how hard the heart is working during the heartbeat. Diastole, on the other hand, diastole is talking about the heart relaxing. Okay, so that is going to be when that those ventricles are filling up with blood. So that is going to be the bottom number. That's going to talk about how well the arteries are staying open and relaxed in between beats. Now, as nurses, you guys are going to be responsible for measuring what are called orthostatics. Okay. Orthostatics are just talking about the differences in blood pressure when somebody is laying down to when they are standing. Okay. So with orthostatic hypotension, when you stand up, your blood pressure drops so low that you pass out. So the way that you're going to do like assessments with this. Okay, first you measure the patient's blood pressure lying down. Then you measure it when they're sitting. And finally, you measure it when they're standing. Okay. There's a significant difference between certain measurements. Okay. it's indicative of orthostatic hypotension. And those parameters are written down here if you guys want to know them. All right, this is just to put it into context of the stuff that you guys are going to be doing. So, orthostatics, you're measuring blood pressure in 3 different positions. This video shows like how the electrical impulses line up with the movement of blood flow. So I think it's a cool video, but like if you don't want to like, I'm not gonna play it because it's not necessary to watch, but if you're curious on how the heart like contractions line up with like an ECG, it's good. This is the diagram from your book that shows you how these different phases line up with an ECG. Again, a little bit more detail than you guys need to know, but it's here. Heart's primary pacemaker is what? SA node. What's the secondary? AV node. And then what's the third line of defense? Purkinje fibers. The sympathetic nervous system can influence heart rate. It is not the like pacemaker. Next, we're going to talk about cardiac output. So cardiac output is going to measure the amount of blood that the heart pumps in 1 minute. Okay, this is going to tell you about how well your heart is functioning. So just reading the definition tells you the formula. So amount, we are talking about volume. Okay, heart pumps in 1 minute, that is the rate. So cardiac output is going to equal heart rate times stroke volume. So the BPM times how much blood is going out with each beat. So in order to calculate this, if you have 75 BPM, is this the heart rate or is that the stroke volume? Heart rate, right? Beats per minute, heart rate. 70 ml would be your stroke volume. Okay, that would be your cardiac output. You guys will not need to do math on this. At most, we will ask you guys like, what is the formula for cardiac output? Something like that. Okay, this is just to put it into context. Now, there's a couple of different ways you can influence cardiac output. So you can increase or decrease the heart rate, or you can change the stroke volume. Now, these are not mutually exclusive. If you increase the heart rate, you will also decrease the stroke volume. And the reason for this is it's like doing a water pump. Okay, if you're like going really fast, right? Each time you pump the water, like one of those like old-fashioned hand pumps, it's going to be a little less water because you're not giving adequate time for that water to refill, right? So you're going too fast for it to like fully refill, if that makes sense. Now for heart rate, okay, it can vary depending on age as well as sex. So newborns are going to have a resting heart rate of about 120 BPM. If you go in and you get an ultrasound when you're pregnant, heart rate's usually actually about like 140 to 150. When the baby's born, it's about 120. That is perfectly normal. It's a really little heart, so they're not able to fill up with as much blood at one single time. So females have a little bit higher heart rate than males. All right. What does Brady mean? Hello. So bradycardia is a slow heartbeat. Tachy means fast. Tachycardia, fast heartbeat. Now, as you get older, your body does change how it functions, right? So cardiac output is going to decrease. Heart muscle is going to pump less effectively. So there's a whole bunch of different things that are happening. Okay. basically behind the point behind the age-related changes, okay? Changes how you metabolize drugs. It's typed out for you guys. It's just on there. Honestly, I don't know how to ask a question about it, so it's just there for your information. Okay. There's a whole bunch of different factors that can impact heart rate. We talked about these like inputs to the cardiac center in chapter 12. So I'm just gonna glaze over them. Okay. You don't really need to know them. Stroke volume, again, these are just things that are gonna impact like how much blood is pumping out. But don't worry too much about this. Okay. Cardiac equals what? Heart rate times stroke volume. Okay. We won't ask you guys to calculate cardiac output. We might ask you what the formula for cardiac output is or like the definition of it. Last thing we're going to talk about for chapter 15 is something called CHF. So congestive heart failure. Now, congestive heart failure is going to happen when either ventricle fails to pump blood effectively. So if you look at this CHF heart here, okay, you can see this like ventricular wall, the muscle on it's like really thin. It's just basically given up. The reason for that is the blood has like put so much pressure on it that it's like overwhelmed. It's given up at this point. Now, like we said, right, you have separate circulatory systems between your right and left sides of your heart. So right-sided CHF and left-sided CHF have different symptoms. Okay. So with left-sided CHF, okay, what's happening is you are getting some sort of traffic jam in your aorta, okay? And this causes left ventricular failure. So for that first question, what causes it? Left ventricular failure. Because all of that blood is backing up into your left ventricle and causing it to pump ineffectively. Now, which vessels drain into the left side of your heart? Where's that blood coming from? Where's it coming from? Pulmonary vein, right? Where's the pulmonary vein coming from? The lungs, okay? So that traffic jam is leading to fluid backing up into your lungs. So all of the symptoms associated with it are going to be lung things. So you're going to see shortness of breath. You're going to see pulmonary edema. Pulmonary meaning lungs, edema, swelling, fluid, okay? The pulmonary edema is going to be buildup of fluid in the lungs. Coughing. So left ventricular failure, left-sided CHF is associated with lung syndrome. Why does this happen? Blood backs up into the lungs. Okay, so this is 2, and then this is 3. Now, just like with right-sided CHF is caused by, just like left-sided CHF is caused by left ventricular failure, right-sided CHF is caused by right ventricular failure. Okay, so if our right ventricle is not working properly, okay, blood is going to back up into the things that drain into our right side of the heart, which is what? What drains into the right side of the heart? Starts with a V. The ventricles are going to be a chamber. So the big veins. The vena cava. The vena cava. The superior and inferior vena cava. Where are the superior and inferior vena cava coming from? The top and the bottom of what? The body. I know, you guys have been like fun studying them and like overthinking, okay? Your superior and inferior vena cava are just draining from your body, okay? So what happens is you're gonna get symptoms throughout your body, okay? So you're gonna see generalized swelling, aka systemic edema. You're gonna see enlargement of your liver and spleen because again, that fluid is backing up to your liver and your spleen. You're gonna see pooling of the fluid in the abdomen, aka ascites. You've ever heard of JVD, jugular venous distension. And then swelling of your ankles, feet, and fingers. Okay? So things that impact your body because it is backing up into your vena cava. Okay? So why is this happening? Blood backs up into the vena cava. And that's the new material. Congratulations. You guys are doing some new stuff. So, for I already released your guys' exam scores. Remediation. Okay. If you guys are doing remediation, the packets and the quizzes are going to be due Saturday night at midnight. The remediation exam is Monday at 3. What else? There's something else. Oh, the final exam packet, duh. So I was making some changes to the final exam based on exam 3 performance because like we don't want to put questions on there that like people scored low on, right? So I had to make some adjustments to the final exam, which means I have to make some adjustments to the final exam packet. So final exam packets should be out either tomorrow or Wednesday for you guys, okay? So I'll send that to you guys in the email. But that way you guys can do those over break. And then we'll come in on Monday and we'll start studying for the final together.
When is the final exam?
December 9th. So we have next week to review and then it's the Tuesday after that.
No, it's in.
I think it's 4:30 for you guys. So. But otherwise, you guys are free. Good luck on your final, or not your finals, your funds exam. But
Thank you.
yeah. Everybody signed in, right? I'm gonna take that as like a collective.